Now it's my distinct honor today to present one of the highest awards that I, as president, give us through the AAKP, the AAKP President's Award during this Public Policy Summit. It's particularly apt. This year we're recognizing Dr. Murray Sheldon, a former Associate Director for Technology and Innovation in the FDA Center for Devices and Radiological Health. The AAKP President's Award is presented to individuals who demonstrate exceptional leadership and a substantive commitment to improving and saving the lives of all kidney patients. It also recognizes demonstrated achievement in the advancement of new innovations, advocacy, and patient-centered care. Dr. Sheldon has exemplified this standard of excellence throughout his professional career and his personal life. He has consistently challenged the status quo, medical mindsets, elevated patient voices and insights, and demanded more measurable progress in American and international kidney practices. This, at times, has put him at odds with medical establishment peers and some special interests, but his courage remained unaffected by the opinions of those who prefer comfort and conformity over the greater care choices and improved outcome for patients. His ideas for new technologies have had a lasting impact across both the United States and global kidney stakeholder community. This is especially true in the field of organ transplantation, notably next-generation therapies, including artificial, implantable, and wearable organs, and xenotransplantation. His empathy for patients was honed through his early years as a leading cardiac surgeon, and then later as a medical device inventor and industry executive. But perhaps his greatest contribution came when he answered our nation's call to public service as a United States civil servant. As an FDA senior advisor, he played a significant role in the elevation of patient insights across new product development life cycles and FDA approval deliberations. Within the FDA and external to FDA, he consistently communicated the same sense of urgency as the kidney patients in his efforts to advance the development of and access to safe, new kidney technologies. AAKP is proud to call Dr. Sheldon a true friend to kidney patients, and we are honored that he continues to be involved in the good fight alongside AAKP. Please join me in recognizing and celebrating the 2025 recipient of the AAKP's President's Award, Dr. Murray Sheldon.
Thank you, Ed, for that very, very kind introduction. I really appreciate it. And I want to give thanks also to the American Association of Kidney Patients for this tremendous honor that you bestowed on me. I'm truly humbled to receive the AAKP President's Award at your Policy Summit and at the National Press Club. To appear before this vibrant kidney community of patients, families, advocates, innovators, and policy officials means more to me than I can really express. I do not view this award solely as a recognition of my individual efforts. Rather, I view it as a reflection of what we've all accomplished together to advance kidney health, empower patients, and reimagine what is possible. Many people consider chronic kidney disease as a treatable disease because we have dialysis and people can be kept alive. But the reality is, when you look at it closely, the mortality rates of people on dialysis are worse than most cancers. The quality of life for the patients is far below that of what most people would consider adequate. And on top of that, the expense to our country, CMS, and our neighbors and everybody else is very, very high. And it is doomed to get worse unless we create newer and better treatments. And it's my hope that some of the newer treatments that we'll describe today will achieve that end. The most meaningful times in my career by far have been working alongside patients and organizations like AAKP and the Kidney Health Initiative to accelerate life-saving kidney innovations and help transcend the high mortality of kidney care, including outdated dialysis. When Cullum invented dialysis initially in 1943 under Nazi-occupied Holland, he took very, very sick patients about to die and gave them another opportunity to live as full a productive life as was possible. And that was truly miraculous and genius. But now we need to take it to the next step, and we need to finish off Cull's dream. I have seen how research, innovation, and patient advocacy have radically changed other areas of healthcare, including heart interventions, cancer care, HIV care, and others here in the US and across the globe. While other fields have advanced, unfortunately, kidney failure has remained stuck at the dialysis level, as well as transplant. And that is just simply inadequate for what we believe we can accomplish now. I know the same can happen in kidney care, and I know the future includes wider care choices and access to implantable and wearable artificial kidneys and xenotransplants. We can and we will save millions of lives through these innovations. During this decade of the kidney, we recognize that change is imperative and status quo is indefensible. For far too long, kidney patients have faced limited options, long waits, and immense burdens. But thanks to the leadership of this community, especially patient advocates, we've turned a page. Today, across the world, investors, developers, regulators, payers, and clinicians are collaborating together and alongside patients to bring these new life-saving innovations to market. In our lifetimes, we will witness these innovations enter the markets here in the US and across the globe at an unprecedented scale. I really need to thank, and I want to thank my former colleagues at the FDA's Center for Devices and Radiological for their unwavering support and commitment to innovation that truly serves public health. And I want to thank the many patient advocates and partners here at AAKP, such as you, Ed, and former presidents Paul Conway and Richard Knight, and others. Over the past decade, you have taught me again and again what courage and perseverance can achieve in the policy arena where people of goodwill unite to save more innocent lives. This award should serve as an inspiration to all of us to keep pushing forward, to continue listening, and to keep working until every kidney patient has access to care that gives them not just years of life, but life in those years. I thank you again for this extraordinary honor. Thank you.
Thank you, Dr. Sheldon. By honoring a professional like Dr. Sheldon, AAKP has set the bar for what we view as true patient champions during this decade of the kidney.
Thank you, Dr. Murray Sheldon, and congratulations from Kampen with love. thanks on behalf of all the kidney patients worldwide.